Hello, I'm State Representative Wes Retherford from the 51st House District. Welcome to Ohio in Focus.
Hello and welcome to this edition of Ohio in Focus, a program that brings state government to you. I'm your host, Patrick Schwartz. We have with us today State Representative Wes Retherford, who serves the 51st House District, which includes portions of Butler County, including the cities of Hamilton and Fairfield, Ross Township, and portions of Fairfield, Hanover, and St. Clair Townships. Thanks for joining us today, Representative.
Thank you for having me.
Well, let's talk about some issues that you've been working on during this 131st General Assembly. The first bill we want to talk about is House Bill 24, the Ohio Elder Justice Act, which you joint sponsored with Representative Davila. Do you want to tell us what this bill does to protect senior citizens?
Yeah, I'd be happy to. You know, I really like being able to work on this bill, and I was glad that Representative Mike Davila brought me along with it. You know, the Ohio elder abuse laws haven't been updated in over 2 decades in the state of Ohio. So obviously nowadays we're seeing more financial scams, frauds, obviously with the advancement in the internet technology and email scams and all that stuff. We needed a way to protect seniors from that. So one of the big components is we upgrade the laws to match the financial scams, abuse, neglect, along with everything else. The other big piece of it is we bring in a lot more people that are what we call mandatory reporters. And the reason we named them mandatory reporters is to give them legal coverage. So if you're a banker in a small town bank, you have protection from being fired or for being sued if you report potential financial fraud going on. And by bringing in these extra list of mandatory reporters that have day-to-day interaction with a potential victim, they'll be able to keep an eye out for signs, be able to report it and have it investigated, and hopefully we can get to the problem before someone's completely ripped off of their life savings.
Great. Well, this bill also creates the Elder Abuse Commission. Do you want to tell us a little bit about what that commission will do? Well,
the big thing about the commission will be obviously to keep track of the database, keep track of the reports of crimes, be part of working with the Attorney General's office to get the training done for the mandatory reporters. And so those are the big aspects of that, plus obviously keeping constant eye on what's going on in the world of elderly abuse and making sure that we as a General Assembly are keeping the laws up to date with what's going on.
What about the groups that you worked with to get this legislation moving? Can you tell us about them?
Yeah, obviously the Council on Aging played a big role in it. They represent the majority of the elderly population in the state of Ohio. The Attorney General's office, who this is one of his key work areas, and Mike DeWine and his staff has been great to work with on it. The County Prosecutors Association is another one. Obviously, they're going to be the ones investigating and prosecuting these crimes. But also a big important role has been my hometown prosecutor from Butler County, Mike Moser. Mike, when he came along in 2011 and became the prosecutor, he started what we believe to be the first unit in a prosecutor's office specifically focused on elder abuse after a lady was ripped off of about $230,000 from a caretaker. It was her complete life savings. And so Mike has been doing this for a while in his own prosecutor's office, so he was able to give us a lot of good ideas and a lot of hints on how we could tweak things and how we can make it work, at least based off of what he's seen in the office, but also still give flexibility for each prosecutor's office to kind of be able to handle it on their own and work out what's going to work best for their community.
Great. Well, that bill has passed the House, so we're excited to see where it's going to go. Yes,
definitely. We just had the third committee hearing in the Senate Health and Aging Committee last week, the interested party meetings, and you know, for the most part, it's been all proponents for the bill. There's been no opponents, and just a couple interested party, you know, looking at the Commissioners Association stuff, because there is a little bit of funding that needs to be involved in this, a little bit extra workload on the Adult Protective Services.
Great. Well, let's talk about House Bill 253, which is the Ohio Rural Jobs Act. You're the lead sponsor of this bill as well, and it's aimed at small business growth for rural and agricultural areas in Ohio. Do you want to explain some of the components of the bill?
Yeah, the main components is basically what happens is with the investments into of private capital into businesses to be able to expand and create jobs, expand their facilities, buy new equipment, and therefore be able to create jobs. Used to be about a 50-50 balance between the rural small business community and large businesses. And as we all know, the small business is the backbone of our society. They create about 2/3 of new jobs. Now, in the last couple decades, it's kind of shifted away from being able to get those businesses that gap funding. So you have a business that maybe needs $5 million to expand, and the bank gives them $3 million, and they have $1 million on hand. They're still $2 million short for this expansion, and it's hard to find that capital. So the Ohio Rural Jobs Act, what it does is it gets these private investors to look at the companies. The private investors have to be either small business accredited or USDA accredited. And they look at these companies and they see that it's a good financial plan, it's a good business plan, and it's worth investing in. So they'll invest the $2 million in there. And then in return, over a 5-year period, prorated back to starting the 3rd year, they get a tax credit for the investment they made if they meet certain qualifications, and as far as success rate and having the capital being returned to them and that kind of stuff.
Great. Well, the way I understand it, it's modeled after the USDA's Rural Business Investment Program. Do you want to talk a little bit about that?
Yeah, and that's basically where it comes from, and what this does is the USDA Rural Business Investment Program is basically this program, but on the federal level. But then the states itself have to kind of pick up as a little bit too, because there's only so much to cover for the whole country. So states are starting to pick up their own program based off this model to kind of be a backbone for the USDA's program, and it's been done successfully in 5 or 6 states so far. I saw numbers where they made a $2 million investment into a boat company in Louisiana, and it created 42 new jobs in an area that had like 8% unemployment and 23% poverty rates. I read multiple success stories from the different states that have been doing it and saw the numbers, and there's a lot of protections against just freely trying to give out these tax credits. And I said this was a good idea for Ohio. There's a lot of communities that fall under the 50,000 threshold, and there's a lot of agribusiness in Ohio. Agriculture is the #1 industry in the state of Ohio. So let's get involved in this, and let's try to help find private capital, so that way investors that know what business models work and what doesn't are picking, instead of the government's picking and choosing losers.
Yeah, and it sounds like this bill could have a big effect on rural and agricultural areas in our state.
And that's my hope. Most of Butler County, my hometown, would fall under this. Obviously, being an agricultural community along with some urban-based areas, but the majority of the state is gonna qualify under this in the Appalachian areas, but where places that have been hard hit by unemployment and poverty rates, and we can start getting jobs and investing in these small businesses and start getting people back to work. And I truly believe that job creation is the solution to about 90% of the state's problems.
Absolutely. And what types of success have other states seen that have enacted this type of legislation?
As I said, for the most part, most part has been very successful just because of the safe falls that are in there, protecting against just being able to throw into any investment and not have to worry about positive outcomes. Mm-hmm. So you're seeing numerous jobs being created. You're seeing money coming back into the economy, and people getting raises, people making more money in areas that have been impoverished. And those are the areas where the funding for these kind of jobs programs aren't available, and now we're making them available.
Great. And what's the status of this bill?
The status of the bill was just introduced, and I actually, as soon as I'm done with here, I'm going to be going to Ag and Rural Development Committee to offer sponsor testimony.
Great. Well, we'll be looking to see how that goes, and let's talk about House Bill 34 as well, another bill that you've worked on, the Healthcare Compact. Can you explain to our viewers what the Healthcare Compact is and how that works?
Yes. Basically, a compact is an interstate contract. So 2 or more states want to enter into a contract, and this is based off of the U.S. Constitution. It gives us the ability to do this. And then the contract, as opposed to being approved by both sides and being filed with courts and all that stuff like you would with a business, it has to be approved by both sides and then approved by a simple majority of both chambers of Congress. A great example would be the Great Lakes Compact, or the compact that allows my driver's license to be valid for use in Indiana if I decide to drive over to Indiana
Absolutely.
or Kentucky. So what the healthcare compact does is it says that the states that enter in the compact will now be responsible for their own healthcare dollars. So on the federal level, basically, and it's based off of 2010 numbers, the federal government spent roughly $33 billion, billion with a B, in healthcare spending in the state of Ohio, and this is before the Affordable Care Act. And what the compact does is it takes that number and it adjusts it for population growth or shrinkage and inflation each year, and that money comes to the state in the form of basically a block grant that we can spend on healthcare. So Ohio can look at its own state-based needs for healthcare industry and establish its own healthcare program outside the Affordable Care Act that's going to work best for Ohioans. And that gives us two distinct advantages, any state that's involved in it. Number one, we can address the concerns of the state, the people of the state, as opposed to trying to fit us into a one-size-fits-all, because what works for California is not going to work for Ohio, and what's going to work for Ohio might not work for Tennessee or Texas or whatever it might be. The other distinct advantage is, as we make adjustments to programs such as Medicaid or Medicare or whatever program it might be, a lot of times that requires a waiver or approval from the federal government. Under the healthcare compact, if we see adjustments that need to be made in the Medicaid program, then we can go ahead and make it without approval, and that gives us the ability to quickly adjust what we're doing on our feet, so that way we don't have to worry about any negative outcomes. And we can address them right away if something negative is happening with the decisions we make.
Yeah, it sounds very different than the current federal healthcare model.
Well, yes. Anytime you start sending control back to the state, it's going to be different than what Washington D.C. likes to do.
Absolutely. And can you tell us some of the advantages of this compact and how it's going to make healthcare more affordable for Ohioans?
Well, the advantages is, number one, we're not going to be stuck with the provisions of the Affordable Care Act. We're going to be able to provide the state of Ohio with its own provisions that is needs-based off of the state. 11.5 million people inside this state as opposed to 300-something million in the country. And as I stated, the other advantage is, as we make adjustments to programs, we don't have to apply for waivers and wait for approval before the adjustments happen. And in the meantime, having the negative effects that we need to be adjusted going on while we're waiting for the approval. We can make the adjustments as quickly as possible, and that way continually trying to hone our healthcare system here in Ohio, so that way we find the system that works the best.
And can you tell us about some of the people and groups you've worked with when you drafted this legislation?
There's been various groups that have looked at it. There is the Healthcare Compact for America. There is a large group that kind of brought this to our attention and showed us not only the constitutional guidelines of it, but the ability for it to work. What other states have been working on it, which they're up to about almost a dozen states now that have signed on to the compact. Also, I've had the opportunity to speak at length with then Congressman, but now Senator James Lankford from Oklahoma, who was the first person to introduce the resolution to approve the compact in Congress. And then also, I've spoken at length a few times with Congressman Jim Jordan here in Ohio, who seems to be very receptive of the idea and was a co-sponsor on then Congressman Lankford's resolution.
Great. Well, it sounds like you have a lot on your plate with these bills coming up. If you could tell your constituents in the district how to reach you at your office in Columbus.
Yeah, I'd be happy to. If you want to contact me at any time in my office, the number is 614-644-6721. You can also email me at rep51@ohiohouse.gov. That's rep51@ohiohouse.gov. And you can also find me on Facebook at State Representative West Retherford. And my office and I are very good about getting back to you as quickly as we can with any answers or helping you out with issues.
Well, thank you, Representative, for joining us today. I
Thank you.
appreciate you telling us about these bills that you've been working on. And we look forward to seeing you again on the next edition of Ohio in Focus, the program that brings state government to you. Thank you for joining us.